By the end of this module, you will understand physiological changes in elderly individuals that impact nutrition and hydration, identify signs, symptoms, and risk factors for malnutrition and dehydration, conduct effective nutritional screening using standardized tools, support safe feeding practices, including enteral and modified texture diets, develop culturally sensitive meal plans that promote optimal health outcomes. Nutrition and hydration are pivotal determinants of health and quality of life in older adults. As the human body ages, its physiological, metabolic, and psychosocial functions evolve, often altering nutrient needs, appetite, digestion, and hydration status. Module 4 of the Elderly Care and Geriatrics course explores the science of geriatric nutrition and hydration, while aligning with global standards, including the World Health Organization, WHO, British Association for Parenteral and Enteral Nutrition, BAPEN, ESPEN, and NICE guidelines. This module is structured to equip caregivers, nurses, geriatricians, and allied health professionals with the critical competencies required to assess, plan, and manage personalized nutrition and hydration strategies in elderly populations, especially those with comorbidities, disabilities, or cognitive impairments. We address key concepts such as malnutrition, sarcopenia, dysphagia, dehydration, enteral feeding, and culturally sensitive meal planning. The module integrates the use of standardized tools like the MUST tool, Malnutrition Universal Screening Tool, and the Mini Nutritional Assessment, MNA, to guide clinical decisions. Physiological changes affecting nutrition and hydration in the elderly. Reduced sense of taste and smell, diminished saliva production, altered gastric emptying and intestinal absorption, decreased thirst perception, up dehydration risk, reduced muscle mass, sarcopenia, and basal metabolic rate. Impact of medications, e.g., diuretics, appetite suppressants, chewing difficulties due to dental issues. Macro and micronutrient needs in older adults. Protein 1.0 to 1.2 grams per kilogram per day to prevent sarcopenia. Calcium and vitamin D, bone health, fracture prevention, iron and B12, prevent anemia and cognitive decline. Fiber, bowel regulation, cardiovascular health. Hydration, 1.6 to 2.0 liters per day unless contraindicated. Energy intake, adjusted for activity level and health status. Malnutrition in the elderly. Types of malnutrition. Protein energy malnutrition, PM. Micronutrient deficiencies. Disease-related undernutrition. Signs and symptoms, unexplained weight loss, fatigue, muscle wasting, reduced appetite, poor wound healing. Screening tools, MUST, MNA, BMI, unintentional weight loss metrics. Causes, financial constraints, depression, isolation and loneliness, difficulty shopping or preparing meals, dysphagia and safe swallowing, common in stroke survivors, Parkinson's, dementia patients, risk of aspiration, pneumonia, and choking, IDDSI, framework for food texture and liquid thickness levels, interventions: speech and language therapist, SLT assessment, modified diet, feeding assistance, hydration, importance, challenges, and monitoring, importance, prevents constipation, UTIs, delirium, kidney dysfunction, signs of dehydration, dry mucous membranes, confusion, low blood pressure, dark urine, reduced skin turgor, barriers, incontinence fear, reduced fluid intake, mobility limitations, lack of access or assistance, monitoring strategies, fluid balance charts, use of preferred cups or bottles, scheduled hydration programs, enteral and parenteral feeding in older adults. Indications: severe dysphagia, stroke, unconsciousness. Enteral methods: nasogastric tubes, short-term. PEG, long-term. Parenteral, IV. Nutrition, rare, used in severe cases. Ethical considerations: informed consent, cultural and religious beliefs, quality of life versus prolongation of life, nutrition in dementia and cognitive impairment. Challenges: forgetting to eat, distractibility, food refusal or inappropriate behaviors, interventions, point, supervised mealtimes, hand-over-hand feeding, simplified familiar meals, bright-colored plates to increase food intake, meal planning, food safety and cultural sensitivity, meal planning, individualized to health condition, preferences, culture, balanced meals with appropriate textures and portions, food safety, importance of hygiene monitoring expiry dates, avoiding foodborne illness, especially in immunocompromised, cultural and religious considerations, vegetarian, halal, kosher, etc., meal times and fasting practices,